Fungal infections are among the most common complaints in our natural world. These can be annoying and prove quite difficult to deal with. I recently caught up with phytotherapist Vincent Tones to find out more about the real causes of these infections and how they can be treated effectively. Vincent, welcome back to the show. It's always great to have you with us.
Good to be back.
Now, Vincent, today we're talking about nails. What are indicators that our nails are not in the best of health?
Well, first of all, I would say just the look of them. There are different signs that there are mineral deficiencies. One can get into serious detail where one can actually look up the brittle side to it, that it's certain minerals lacking, that they're spotted, that there's white marks, that there's striations, that there's many different signs and symptoms. But the way to do it is actually just to always know that if there is something lacking, where the nail is not strong and where it does have discoloration, where it does have little lines going through it, your minerals are low. So in other words, get your veggie levels up, get your greens up. It all relates to minerals. Minerals from our earth, your trace minerals, your trace elements. It just really means that your diet is lacking on the goodness side, the vitamin side,
so it's not so much. It's not so much necessarily about the health of your nails. It's actually the health of yourself and how that impacts your nails.
Absolutely, yes. What goes in your mouth depends on how healthy your hair, skin, and nails are.
At what point can it be a distinguishing factor between the nail being an indicator of your health and just having an actual problem with your nail, like a fungal infection or something like that?
Yeah, that's related. I mean, fungal infections, its cause ultimately is number one external factor. Number one, meaning that if one is prone, or if you have a cut, or if your nails have actually been damaged and there is a fungal infection around, it'll be the first point of call that that fungal will start aggravating that area if there's a fungal infection in proximity. In other words, a bacterial fungal spore. Secondary, obviously, is your dietary side. That's linked to what goes into your stomach and what you eat.
What are some of the things that we should be keeping in mind regarding our gut that can impact the health of our nails? Especially, I'm thinking about antibiotics, medications that we might be taking, and how they impact the functioning of the gut and by default the other parts of our body.
Your main causes, antibiotics is an antagonist, contraceptive pills, prescription medications, antidepressants, dietary intake, sugary type foods and so forth. Basically, your stomach lining, your stomach has you've got your muscle lining, then you've got your mucus lining. And your mucus lining is your protective layer. And what happens is that if you start getting a fungal infection of the stomach, I normally compare it to an old loaf of bread. You have an old loaf of bread with mold on it. You get a similar type of mold that starts forming within the mucus lining, which is almost like it's termed candida. And that fungal infection of the stomach that's caused by medications and so forth, an imbalance of bacteria, friendly bacteria in the stomach, then comes through into the bloodstream, that fungal infection. Then which it comes through to the skin, and it comes out as thrush, eczema. In other words, any fungal type infection of the body externally normally filters back to the stomach. So you may get a fungal infection that's short term in terms of the nails, but if it keeps recurring, it's telling you that your stomach is actually at fault and that you need to actually repair it. In other words, go and get yourself a decent probiotic. Get your probiotics, get your yogurt intake if you're not lactose intolerant. Go have your yogurts, get your natural bacteria back up. And that would be an absolute prerequisite, is repair the stomach itself. I'm not saying cut out the contraceptive pills or anything. I'm just saying that balance your life. Take your probiotics. Take them. In other words, if you're prone to colds and flu and immunity is down, take your probiotics to get your stomach correct and get it balanced again, and your immune system will come right.
And in terms of bad habits and things like that, I know biting of nails, hangnails, all those sort of things that we do without even thinking about it sometimes.
Actually almost tear the skin between almost at the nail bed itself. And that's when external bacteria can get straight in and start harboring in that area to form a bacteria and an infection. And then, as I mentioned earlier on, ladies paint nails and go for manicures and things like that. Is there a risk in that space that you can pick up some kind of a fungal or bacterial infection? I think a lot of the nail professionals, they are well trained, but it is something to sort of be aware of. Is the fact that one should try to be as gentle as possible, not to break the skin itself.
Yes.
So to work with the nail, but not to break into the actual inner cells of the bed and cuticle and so forth. You've just got to be very careful not to, so that if you're breaking into that area, you would have to have ultimately an ultra clean nail, which is almost impossible.
Yes.
So be gentle when working with nails.
So obviously, if you're doing it yourself, the same applies. If it hurts, it's a bad idea.
It's a bad idea. If it hurts, that's a definite.
Who might be at most at risk of developing an infection?
I think any person who's working with their hands. So any person that's compromising their immune system and working with their nails or working on their nails or having been worked on their nails often. Would be prone. So it's all about immunity, stomach.
Yes.
So immunity compromisation would be things like smoking and would be medications, incorrect diets.
Yeah. So in terms of general cleanliness, hand washing, hand sanitizers, things like that, is that a good idea just as a precautionary measure to make sure that we don't expose ourselves for a prolonged period to organisms that might be out there?
I think it is a good idea without obviously going for cleaning type agents that are drying. So in other words, try and get organic type cleansing and cleaning material or bases that you can use that are more natural, that retain your oil levels, that don't dry the skin out too much. So that's important. And in terms of feet, I mean, shoes, obviously clean shoes, changing your socks, showering, cleaning your feet, all of those things. Aerate your feet.
Too.
I think
go barefoot.
Absolutely. Yeah,
but be careful of what you walk on. It's a bit of a tough one to get right.
It's about earthing yourself.
Yeah, absolutely.
I think ultimately if one was sort of near the ocean, it would be a good thing, but it depends on how clean the ocean is.
Now, Vincent, in our Real Health Medicine cabinet, we have a product called Nail Fix, which is for treatment of fingernails and toenails that have got some kind of an ailment or an issue. Tell us a little bit more about how something like this works.
The formulation was actually put together for internal ailments. And then with some use and research and development, my wife actually put it together for her nail infection, which was recurring, very stubborn, where it actually got to a point where there was a lot of pain. So we actually took a combination of aromatic oils and a couple of herbal extracts that we put together for serious ailments internally. And the combination together, we found that it actually drew the oils through the nail itself into the bed, where it actually became almost like absorbable through the nail, which was amazing. So it has aromatic oils, it's got herbal extracts, a very expensive herb extract from South America called bloodroot, sanguinara it's called, and it is highly anti-pathogenic. So anything to do with bacteria, fungals and so forth, it would probably boost your immune system and the absorbability side. While using it on your fingernails, it's an all-rounder. It's got lemon in it to repair the skin itself. It's got your clove oils. It's altogether almost 15 active ingredients. Absolutely amazing. All you do is spray it on literally once onto the nails, like that, once, and just rub it with your nails together like that, like that, and like that. One spray. It will change color to a slightly amber color if there is an infection. So you'll actually know.
So it'll show you.
It will show you that there's something happening. And we've actually had customers phone and saying, hey, I've got brown, a color, it won't stain, but it will change. And then as that fungal infection starts getting better, it becomes clear to the point where you don't see any reaction. So a bit of amber color, then after about 5 minutes it dissipates and it's gone. But you can actually use it before you go for a nail treatment. And you can use it after if you want to, but before they even do their anti-sanitizing and cleaning as a preventative and as a treatment.
Brilliant. Vincent, where can we find the product?
Clicks. You can get a Clicks, Dischem, pharmacies, independent pharmacies, and selected health stores, and beauty salons have now ordered.
Super. Well, Vincent, thank you so much. I think you've given us a lot to think about just in terms of general health and the fact that your nails are quite an important indicator of your health and the fact that you can take action to sort that out.
Lovely. Yes,
Wonderful.
absolutely.
Great to have you. Thank you.
Thank you, Michael.